Hello, present and future nurses. Today we're diving into a topic that's not just critical for your NCLEX, but also for your nursing career: Ebola virus disease, or EVD. Buckle up, because by the end of this video, you'll have a solid grasp of its symptoms, treatment, and prevention. Let's get started. First up, etiology. Ebola viruses belong to the Filoviridae family. There are 5 known species: Zaire Ebola virus, the most lethal, Sudan Ebola virus, Thai forest Ebola virus, Bundibugyo Ebola virus, and Reston Ebola virus, although Reston doesn't affect humans. Knowing the causative agents is key to understanding the disease. Next, let's talk transmission. Ebola spreads from human to human through direct contact with bodily fluids like blood, saliva, sweat, vomit, feces, or semen. It can also spread via contaminated medical equipment and surfaces. Animal-to-human transmission primarily involves fruit bats and non-human primates. Direct contact with these animals can introduce the virus to humans. Now, the incubation period. It typically ranges from 2 to 21 days, with an average of 8 to 10 days. So if someone's exposed, symptoms won't show immediately but can take up to 3 weeks. Speaking of symptoms, they start mild but can escalate quickly. Early symptoms include fever, severe headache, muscle pain, fatigue, and sore throat. As the disease progresses, symptoms can become severe: vomiting, diarrhea, rash, impaired liver and kidney function, and internal and external bleeding. Yes, it's as serious as it sounds. For diagnosis, clinical observation is crucial, especially in endemic areas. Laboratory tests like PCR can detect viral RNA, and serological tests identify antibodies. Isolating the virus from blood samples confirms the diagnosis. When it comes to treatment, supportive care is the cornerstone. There's no specific antiviral treatment, but maintaining hydration and managing symptoms are vital. Experimental treatments like monoclonal antibodies and antivirals such as remdesivir are being studied for effectiveness. Prevention is where you can make a huge difference. Surveillance, contact tracing, and safe burial practices are essential public health measures. For healthcare workers, personal protective equipment, PPE, is indispensable. And good news, the RSV-Zebov vaccine has shown effectiveness in preventing Ebola in outbreak settings. In public health considerations, outbreak response coordination among organizations like HHU and CDC is vital. Education campaigns help communities understand how to prevent and control outbreaks. As nurses, your role is critical. Implement strict infection control protocols, use PPE correctly, and regularly monitor patients' vital signs and fluid status. Educate patients and communities about prevention strategies and symptom management. For the NCLEX, remember these key points. Understand Ebola's transmission and epidemiology, recognize clinical presentations, and emphasize supportive care and infection control. Be aware of outbreak management and the importance of public health response. In conclusion, a thorough understanding of Ebola, from symptoms and treatment to prevention, is crucial for your nursing practice and NCLEX success. If you have specific questions or want to dive deeper, drop them in the comments below. Thanks for watching, and stay safe out there.